Hey, it's Dr. DeCubellis here. I wanted to talk about this a little bit. Some of the doctors I work with have kind of brought this up. And then also, being that I've had offices in a couple other states, I've seen it as well. And what the difference between working on a lien versus working in like a no-fault state and having PIP coverage. Very interesting. Now, here's really the difference. And this is really what it all comes down to. Doctors who work in a no-fault state that has PIP coverage, guaranteed coverage for injuries, they don't have to be as good. They don't have to be as good. They just don't, because they know that there's a minimum guaranteed there. They can go through, treat patients, don't even have to worry about making sure they're doing everything as good as they should be, because there's going to be payment there. Now, I'm not saying every doctor in those states is not good. There are definitely very good doctors in no-fault states. What I'm saying though is it makes it easier to set up what you call PIP mills, where we have these clinics who get together, just burn and churn patients through, make sure they build them up to what their allowable amount is, kick them out the door. Doesn't matter what their diagnosis is, doesn't matter if they're done with therapy or treatment. They're just going through and billing them up to their maximum. Now, when we talk about a no-fault state, we're working on a lien. Now, the same thing can definitely happen. You can still have doctors who are working on these cases who don't necessarily know what they're doing and aren't working maybe the best that they can for their patient, but it's going to make it a little bit harder. And what I mean by that is, since we're working on a lien, it means that you're going to have to be able to prove everything you're doing to get paid. And if you're not, there's a potential that not only are you going to have your bill reduced, but you might not get paid at all if you didn't make sure that you did everything that was legitimately needed by the patient at the right time for the right outcome measure. So what's the difference between the two? Well, I think both are very different in the way that they're attacked. I think that really the biggest thing is communication. Communication between the different doctors that are working on the case, but also with the attorney that is involved in the case as well. The attorney has to know what's going on, what's being treated for, what the diagnosis is, how long the potential treatment is. And then on the other side too, we have to know, how is it looking? Is this looking like something that's going to need to go to trial versus if it's something that the insurance is going to try to sell for right away? That's very helpful too. I never like to settle a case in the middle of treatment. I don't think that makes any sense. I don't like working with attorneys that try to settle it in the middle of a case unless there's an explicit reason for it. But again, that comes back to the communication. We need to know what's going on because also you don't want to, as an attorney, assume that a case is the client's being done treated. You go to settle the case and you find out, oh no, they're going to the pain doctor, and the pain doctor is still operating on a lien. It's like, what's going on here? The communication has been lost, and because of that, makes everyone look stupid. We don't want to look stupid in this stuff. So really, really interesting. Here's kind of my thoughts on this. Just make sure that you know exactly what you're doing. You do everything by the book, document everything, make sure you're legitimately treating the patient for injuries that you find, making sure that you have outcome measures that make sense, making sure you have treatments that make sense. And it really doesn't matter whether you're in a no-fault state or you're working on a lien, as long as you're doing right by the patient. If you're doing right by the patient, you don't have to worry about anything. Don't try to just get in and burn and churn and build people.